Joining me now is the coordinator of today's big event, Dr. Sreedhar Potarazu. He is the CEO, of course, of Vital Springs Technologies, author of Get Off the Dime. Doctor, good to have you back.
Good to be back, Neil.
Did you bring white coats, lab coats?
Of course.
Yeah.
It's their profession, so of course there's going to be white coats.
So it wasn't like a White House deal where they just hand them out. But I guess they have to hand them to doctors. They can't be just handing them out to, like, me, right?
Neil, it's going to be very significant tonight. The president has said that Washington has spoken, but the fact of the matter is that the biggest transformation to the healthcare system in the history of the United States could potentially happen, and we haven't heard from within the profession. And we have tonight at the National Press Club some of the top physicians around the Washington area who, in fact, would take care of some of the lawmakers who are making these decisions. And we have so many physicians that are going to be speaking tonight about why they're against what's going to happen, the impact to the quality of care that's going to be delivered, some of them talking about even leaving the profession, and some of them, more importantly, Neil, in the constituencies of Chris Van Hollen, in the constituencies of Steny Hoyer, of Barbara Mikulski, doctors there that have been in practice for decades who are totally against what's going to happen and what's impending. So it's a significant statement that if you have the lawmakers out there saying that we've got the best prescription for the healthcare system, and yet the doctors that are taking care of them, hundreds of them out there that are speaking tonight around the Washington area saying that they don't agree, we have a real problem.
Doctor, here's the one thing I don't understand. The AMA, the American Medical Association, I don't know if you remember, but many, many doctors are. They wrote off on this thing and said, hunky-dory with us. And there were a bunch of them in their white lab coats. They came to the White House and said, just fine by us. There's got to be a disconnect because, I talked to quite a few doctors and not a one. And believe me, both on a personal, professional basis, I know doctors. They don't like this. And they don't, I don't know what the disconnect is.
The disconnect, of course, is the politics and the lobbying of this. So the AMA, quotes unquote, says to accept it. I had a conversation with a couple of board members who agreed sort of behind the scenes that, but didn't want to go on the record. In fact, Neil, I'll tell you anecdotally that tonight's meeting should have happened a couple of nights ago on Monday. In fact, a major medical center in the area agreed to host it. And then they got a call from 1600 Pennsylvania towards the end of last week asking them to cancel the meeting because the message could not be controlled. So there you have it.
What is the thing they fear most? I understand, care could be compromised. Certainly a lot of their pay could be compromised. But what's the biggest thing they fear? Because I hear a lot from these general practitioners who, all the way up to the top neurologists and cardiologists at the top of the income food chain, if you will, who think that this is going to be the death of their industry. Well, why?
You're going to hear it tonight, and I hope, Neil, that what we record tonight and what's going to be taped tonight is going to go all over the country tomorrow morning.
Tell me the one thing they fear the most. Just tell me that.
Overflow of their waiting rooms, and that the fact that their patients aren't going to get what they need, and that the quality of care is going to drop. And they simply can't do what they're supposed to do and do it well. That's the bottom line. And physicians are already strapped, and they feel absolutely convinced and very adamant that there is no way possible under what's being proposed. Nobody disagrees that reform shouldn't happen,
right,
that we have to hold insurance companies accountable. No arguments. But it's the execution. And you're going to hear the voice tonight of the experts. We're reforming the industry of doctors. And these are the people that are speaking on how their industry is going to be reformed. It's a significant voice.
All right. Well, if they're anybody like you, they should be very significant. Doctor, thank you very much. Always good seeing you, my friend.